Do you have a finger that gets stuck or locks when you try to straighten it? That's called a trigger finger, and if you have ever had it, you know how frustrating and even painful it can be. While severe cases might need medical attention, there are natural remedies that can help relieve the symptoms and improve flexibility. Let me share one simple hack you can do at home. First though, what is trigger finger? This happens when one of your fingers gets stuck in a bent position and then straightens with a snap, like pulling and releasing a trigger. Oftentimes you can feel a swelling or a nodule in the palm of your hand. Tendons in your fingers are like ropes that help them bend and straighten. These tendons slide through a small tunnel called a sheath. When the sheath becomes inflamed or thickened, the tendon can't glide smoothly. This causes the finger to get stuck or lock. Oftentimes the symptoms are worse in the morning. Who is at risk? Anyone who performs repetitive gripping actions, like typing or gardening, but also middle-aged or older adults. But certain conditions like diabetes or rheumatoid arthritis can also make you prone to trigger fingers. I do see this fairly common in our arthritis patients, and we often do injections for it. First step could be to start with a warm compress. Heat can help to relax the tendons and reduce stiffness. Soak a clean towel in warm water, wring it out, and wrap it around your affected hand for 10-15 minutes. You can do this 2 to 3 times a day. You can also try gentle stretching exercises of that finger, or massaging it in a circular fashion along that bump that you feel in your palm. Others find benefit with splinting the finger. This would limit tendon movement and reduce inflammation, but this isn't always helpful. Sometimes steroid injections work better. In that case, a little bit of corticosteroid is injected in the tendon sheath, not the tendon itself, and this can be very helpful. But not everyone wants to jump to injections. Something very easy and cheap to try is the ice cube trick. All you need is a few ice cubes in a Ziploc bag. Make sure the bag is tightly closed and hold it over the affected area. Close your fingers around it as if you are making a fist. Hold until the ice melts. Do this 3 times a day for 3 days. It's like an ice pack for your finger. Hopefully the pain is gone at the end. If not, it may be time to go in and see the specialist. You don't want this to be permanent. And a quick tip. If you have multiple trigger fingers, this may be a sign that something more, like a systemic condition, needs to be worked up. If you are doing activities that may be causing the trigger finger, stop them or do for a shorter time. If you must use vibrating power tools, try wearing padded gloves. Sometimes, despite using these conservative measures, trigger fingers don't resolve. Sometimes injections help and other times they don't. It is important to get seen. If you've had a trigger finger, how did it get better? Drop a comment. Join me next time at Plant Forward MD as we discuss tips and tricks to take care of our health.